Here at the Pelvic Health and Rehabilitation Center, we see a high number of patients that come to us for a second opinion after they've already been undergoing treatment for vulvodynia. For one reason or another, things are not improving. So today, I'm going to talk about the top 5 reasons people may not be improving with their treatment program, and most importantly, what you can do about it. One of the most common things that we see when patients are coming to us if their treatment plans are not helping their symptoms is they may not be getting the right combination of therapies in the right order. One of the most common subsets of vulvodynia is called hormonally mediated vestibulodynia. This requires a combination of medical management and pelvic floor physical therapy. We understand that a lot of times people haven't been able to get their physicians to diagnose them properly with this subset of vulvodynia because it actually is often diagnosed by a vulvar specialist, which everyone may not have access to. However, in physical therapy, we can examine our patients and combined with their clinical history, determine if we think this patient needs medical management for their vulvodynia. If that is in fact the case, we have tips and suggestions on how people can talk to their regular gynecologists or hopefully refer them to a vulvar specialist who can help. Pelvic floor physical therapy will be very effective for reducing the pelvic floor dysfunction associated with vulvodynia, but if there's also hormonal compromise, it's going to be difficult to fully recover. The combination of the medical management and the physical therapy is what gets patients to 100%. So a second issue that people may encounter is they may not be able to tolerate the physical therapy or it just doesn't seem to be working. There's several reasons why both of these things can happen. If a patient can't tolerate the physical therapy, it most often goes back to what I previously said, and that there may be such significant hormonal compromise that internal pelvic floor physical therapy is actually not appropriate until the tissues have had a chance to heal. Now, what if the physical therapy is just not correct? So sometimes patients are undergoing physical therapy maybe with somebody who isn't as experienced with vulvodynia. Maybe the physical therapy only consists of internal pelvic floor work, when in actuality, the pelvic girdle muscles and the fascia surrounding the opening of the vagina and the bony pelvis also have compromise, and it just may not be being addressed effectively. Now, sometimes people go to physical therapists, they may not have time to do more than just internal work. And in some cases, that may be okay for patients. But if you're not getting better, we need to consider why. And sometimes we see that these external structures have been completely missed. So another issue that we may see is the home exercise program is either incorrect or ineffective. So most of our patients with vulvodynia have high tone pelvic floors, which mean that their muscles are too tight. The home program should consist of pelvic floor relaxation exercises, diaphragmatic breathing to help relax the pelvic floor muscles, and foam rolling to the pelvic girdle muscles that may have a negative influence on the pelvic floor. Oftentimes when we're seeing patients coming from a different program, they're not sure how long they should be foam rolling, where they should be foam rolling, how often they need to be trying to do pelvic floor drops and trying to relax the pelvic floor. And sometimes patients just can't actually do it yet. So they may need a little more assistance in the clinic before they can effectively do pelvic floor drops and relaxation exercises at home. We need to put specific parameters around which muscles need to be foam rolled and for how long to actually create a change that's going to help relax the pelvic floor muscles. One of the things that we see is sometimes people try to just resume their normal activities just a little too soon. If they're in a place where their pelvic floor muscles cannot fully relax after being engaged in something like planks or squats or core activity, then the pelvic floor muscles tighten when they do these exercises and their symptoms can increase. We help people learn how to relax their pelvic floor muscles and give them the go-ahead that these other activities are in fact safe to do once they can relax their muscles. They can do what they enjoy and it's not going to backfire on them. The fifth and final, and maybe one of the biggest issues that we see, is regarding the application of the topical hormones. So for example, if you're missing a tiny little spot of the vestibule, you're still going to have the same amount of pain even though the majority of the tissues are healing. In the clinic, we help our patients identify the areas that they may be missing with the topical. We show them how to apply it and how to feel the area to make sure that they're getting the medication on properly. So let's say everything's great and people are actually applying the topical to all the areas, but they still feel like they're not getting better. It is so important to follow the instructions of twice daily. We are not able to take a day off, to take a morning off, to take a night off, or just not do it on a few days of the week and think that that's going to be okay. Every time that happens, we have to reset the clock and start going again twice a day, usually for at least 3 months. And I say at least 3 months because everybody's body's different. They change at different rates. And sometimes people think, oh my gosh, I've been doing this for a month or two and I'm still not better. I'm just not going to do this anymore. We cannot give up. So what we do is help people see if the vestibulodynia is still present, if they're missing areas, and really help patients stay on track with how long we need to do it by monitoring their symptoms. And every few weeks we can examine the tissues both in the clinic and in the pictures to see what areas are changing and what may need a little bit more therapy. It is common for patients to struggle at different times during their treatment plan. We can help our patients and people with vulvodynia figure out what isn't working in their treatment plan, and going back to the right combination of therapies in the right order is usually what's going to help get people to the other side. If you'd like to see more of these videos, please leave us comments. Please subscribe to our channel. We are also available both on digital health and in-person appointments if you feel like you need a little bit more individualized attention to your particular case.